My fellow Papua New Guineans, especially on the outset, let me remind us all that these are very challenging times in a very fluid environment, whereas we see the landscape changing overnight, and as far as COVID-19 is concerned. We're dealing with a global pandemic, a virus that has infected over 16 million people worldwide and claimed the lives of over 600,000 people. Whilst there are doubters and skeptics out there, criticizing the NCC and the government's efforts at every step of the way, and as far as the steps that we're taking, let me reassure you all that our pandemic response efforts are the best possible practices that we've sought our best legal and medical advice on, in terms of how best we can also respond to the COVID-19 pandemic in the country. Before I go on, let me invite the Deputy Controller, Dr. Dakulala, to take us through an update, his usual updates, and then I'll finish off with expanding on the measures that we've issued in the last day or two. Thank you.
So as you heard from the Controller, the global picture is not encouraging because the numbers continue to escalate. And so on day 42 of the NIFLA passing, we have about 16,612,326 confirmed cases of COVID-19 in the world or in the globe. Just digest that, that's very, very challenging. And then the second point is that not only that, 655,502 people who had COVID-19 died. And that's only within the last 126 days since since the state of emergency was uplifted. And in the 4 months, the total of the cases have been in the globe 16,239,571, and also 639,271 deaths within 4 months. So these are very, very challenging and very, very grave statistics that we must note of in our global picture. And what is more, in the last 24 hours, there was an increase of 205,078 confirmed cases. So that record is like every day increasing as we speak. So when we come closer to home in Indonesia, the figures are also very big. 100,303 total confirmed cases in Indonesia. The deaths, 4,838. In Papua province of Indonesia, 3,341 total confirmed cases, with 121 new confirmed cases occurring in Papua. And the point about Papua is this, that all over the Papua province there have been cases reported, and especially along the border areas, the cases have been reported. And let me just give some figures there. Up in Kota Jayapura, on the 27th July, the number of positive cases was 1,775, and there were 23 deaths. In the middle part of Papua, a place called Bovin Digiol, or Digiol, 17 positive cases and no deaths. Down in Merauke, 27th of July, 31 positive cases and no deaths. So, ladies and gentlemen, the point is that on our borders and very close to us in Indonesia, the cases are very high, and in fact, Johns Hopkins University in US has, through its research, declared that the cases in Indonesia may be twice the number that is been reported. And so that's a very interesting statistics, and we must take note regarding where we are in our country. when we get the Western Pacific region updates, then the countries that are linked up with us, for instance, Australia has 532 new cases with a total of 14,935 cases and deaths of 161 that have died. And we go down to Philippines, 1,657 new cases with a total case load of 82,040. Total deaths of 1,945. Singapore, the figures are 469 with a total case load of 50,000, or cumulative total of cases of 50,838 with 27 deaths. So what am I saying again, ladies and gentlemen? I'm saying that these are statistics that are very, very of big concern in the globe, in our world today, but in our region and very close to us in the province that we share borders with. And so we really need to be taking stock and be vigilant in the way we approach the COVID-19 situation in our country. So now when we come to our country, since March 21st, 2020, we have started off initially with 1 case, then there was 2 cases or so, then 6, and then for a long time, 8 cases we have had from April or around the April month all the way to July. And then suddenly we started to see spikes that have happened almost like Mount Everest climbing. And so we've had cases that have been 11 and the latest up to 23. And so the total cases that we have had in our country up to date is 62, which is something that has never been recorded before. So when we come to the testings of all our COVID-19 samples, we have done just about 10,000 tests in our country, 9,943. If we add on some that we have now waiting to come in, then it will add up to 10,000 now. And out of that, as I said, 62 have been confirmed, 40 are still pending results, 9,248 are negative, and 51 of those are active cases. And they are in the Rita court as we speak. But unfortunately, 2 have had a fatal outcome. We have had, for the first time now, deaths that have happened in COVID-19, 1 yesterday and 1 today. And I have the certificate of one of them here, which clearly certified that it was a COVID-19 death that had happened. The second case, we are waiting for the confirmation of the medical certificate, but it looks like the second case was one that was with comorbidities, meaning that there's other problems with him in terms of his medical issues with COVID-19, and that would have been what would have complicated him and was the result of his death as well. Now, when we look at testings, this is the key message that we need to do, because we will have to do quite a lot more testing in order for us to get the yield that we think we have. And according to the models that we have, we probably might have around about 10,000 cases right now as we speak in the National Capital District. And that we can only confirm that through scale up of testings. And that is what is one of the strategies that will happen as we go forward. But I'll let the controller speak about the measures, how we are going about it. But from the medical point of view, we will increase the testing to scale up to get to the number as close to what I had just alluded to, so that we can find those that test positive, and then we put them into isolation, and then enable them, also those who are persons of interest through our contact tracing, to get into quarantine, so that we minimize the spread that's happening now in our country. Now, some of the things some of the testing challenges have been how we have embraced the testings not only in National Capital District but also throughout the whole country in terms of the provinces. And so there are concerns that we need to be working hard on to ensure we scale up and deal with the issues that have been the reason why there's low testing, so that we can scale up in terms of our testing capacity. And so one of the big things that I want to finish off with as I come through to this brief is to talk about the non-pharmaceutical interventions that are very, very important. And what I mean by them, if you see behind me, there's posters that have been posted up there, and those posters are there bringing forth the message about how we deal with our activities in relation to this virus. And so the messages that are given are very important, and it can be in the form that you see there at the back written, that will be distributed throughout the country and all parts of our city here as we go through this, the measures that are going to be happening. But it will also be done through the speaking and the awareness that's important. And so these non-pharmaceutical interventions, as we get them out to everyone, it may take time. Sometimes it takes 2 weeks before we see an impact, but you know that this has to be continued, reinforced, because behavior takes a lot of effort in order for it to change. And so I want to finish off and let our good controller continue on to finish off in the measures. But let me say, let's stay vigilant, let's take it serious, because it's no longer an issue that we should be complacent about, because we have had fatal outcomes. Thank you, ladies and gentlemen.
Whilst we're being proactive here in the NCC against COVID-19, we are also determined to keep COVID-19 at bay. And we'll do everything possible to keep our people safe, especially those in the nation's capital. Now, key to all of this is our defense, and our best defense is self-defense. Okay? The government can only do so much. The bureaucracy can only do so much. Our good doctors, nurses, our health workers, our frontliners can also do so much. But at the end of the day, it is up to us, individuals, communities, to realize that our best defense is self-defense. So you're not going to wait in government, lo toimi lo wear a mask. No one wait in NCC or controller or deputy controller, lo toimi lo safe distance, lo wasi man. Because all got the talk so, all got the good talk so, and me plug in finish. Time lo SOE come now. Best defense, or best way lo bani simu, lo COVID-19, or some Governor Pakop talk, Arim talk. Best defense against COVID-19, you yet. At the end of the day, you decide what is best for you. What we can only do here is provide a responsible response to this COVID-19. This appeal goes out to all residents of Port Moresby and nearby environs, that is Central Province, even as far as Gulf Province. Those who transit regularly into the city, those who call the city home, those who conduct business in the nation's capital. We cannot be complacent. The Prime Minister has told the nation time and time again, the Deputy Controller, all our health experts, continue to remind us all, the best defense to COVID-19 is basically how we respond to it as individuals and as members of our communities. So again, based on what's happened or transpired in the city, let me take this opportunity to express our condolences to those, to the two that have since passed on. Condolences to the families. again, this is just a very good example of what COVID-19 can do to our country if we do not, and to our peoples, to our loved ones, to our children, to our parents, to our brothers and sisters, if we become complacent. And with due respect to those two that have since passed on, there are circumstances relating to them contracting COVID-19. But at the end of the day, what it does tell us is that COVID-19 is here. And will continue to be here in this city, in this country, until a concerted effort and a collaborative effort between state agencies, the NCC, provincial authorities, municipal authorities, and our communities. Until we get that collaboration happening, the times ahead will be very challenging for us. We will continue to give our best response, as I said, because, in as far as the public health capacity for us, and this is why we have brought out these measures, is to ensure that we continue to operate in an environment that whilst we still have the opportunity to do so, to operate in an environment and determine, our intervention strategies to allow us to do so under our very limited public health capacity. It is all pure and simple. If we only have 70 beds, if we only have 100 beds, we can only plan to deal with that as a contingency, to be our response. Now, our public health systems, whilst, with due respect to our public health workers, they're doing a marvelous job. I join our Prime Minister, I join our Deputy Controller in acknowledging our frontliners. They're doing a good job for the country, but we need to meet them halfway. So as such, in light of the increasing cases in the nation's capital, in light of our two compatriots that have passed on, I felt it necessary, and again, in consultation with the NSAC, the National Security Advisory Committee and the National Security Council, and this morning with the NEC, we proposed certain measures, and yesterday they were issued, of which 11 measures were issued as of yesterday, and these measures come into effect on the 29th of July, which is tomorrow. The first measure, of course, revoked all previous measures issued previously. Measure 2 deals with international travel. The only major change to this measure is that all international passengers will now only fly into PNG from either Cairns or Brisbane in Australia. Measure 3 deals with domestic travel and requires that all flights are required to follow certain requirements as outlined in the particular measure. Measure 4 deals with the provincial coordination. We've just heard from the Deputy Controller. Our best strategy at this point is to map out, and we continue to do so, through testing, what in the provinces, with NCD included, but at the same time too, standing up our response capabilities in the provinces. Greater coordination is needed, because what we do in NCD to contain the spread here will provide a blueprint if this, God forbid, if this situation replicates itself around the country. Okay? If this happens in Ley, at least we've learned from what we've done in Moresby, what works, what doesn't work. If it happens in Hagen, at least we know that, what type of appropriate intervention strategies that work or don't work, and so on and so forth. Measure 5 deals with burial of deceased persons. This, of course, is a precautionary measure, and this is needed. We hear and read from time to time about our morgues being filled up, our public morgues being filled up by unclaimed bodies. Let me again appeal to those who have loved ones in public morgues around the country. Please make it your responsibility to claim them and put them to rest. That is the least that they deserve. Okay? Otherwise, you'll see as we witnessed in Ley, the public health system will be forced to take appropriate and legal measures to empty their morgues. Measure 6 deals with customs duties, and this is specific to any materials, whether it be pharmaceutical, non-pharmaceutical materials, to assist us in NCC to provide and continue to sustain our efforts in defending ourselves against COVID-19. Measure 7 deals with COVID testing. Now, again, we cannot impress on you all the importance of testing. The more we test, the more we know about COVID-19 in the country, the more we know about COVID-19 in the city. Measure 8 deals with the surveillance and testing, and this is more focused on our rapid testing teams. Now, as in the next 14 days of the lockdown in NCD, you will see a greater effort in testing, and these testings are being done by our rapid testing teams. If you are called on, or if you are directed to test, again, an appeal to all city residents, do so. Through that, then we're able to know whether or not there's community transmission in your little communities around the city. And if we do pick it up, then we're able to respond to it appropriately. Measure 9 deals with business and social. So there's certain businesses that have, whilst some economic value, it does not have any social benefit to our interventions in stopping the spread of COVID-19. Business 10 makes it mandatory, as evidenced by myself and the Deputy Controller, to wear masks. I understand this shortly after lunch today, the Divisional Commander for NCD Central, Mr. Anthony Ugambi, and his senior team from Barocco met with the NCD Health Task Force, for which they launched the No Mask, No Service. So as a condition of entry, as a condition of being provided a particular service, whether it's in the shops or in the banks, whether it's hopping on in taxis, for instance. If you're not wearing a mask, then those who are responsible for providing those services have the authority now to refuse you entry. Because not only are you putting yourself at risk of exposure to COVID-19, but you're putting those people who have made the conscientious decision to protect themselves against COVID-19 at risk as well. Measure 10 deals with public transport here in NCD. Now, most of these measures, may I remind you all, are specific to NCD, and it is consistent with our intervention strategies in ensuring that we do our utmost best to contain the spread in NCD. So the Measure 11 again deals with public transport. As of tomorrow, all PMVs will cease in NCD. The only modes of public transport that will continue to operate are taxis, and even then there's certain protocols that need to be observed whilst on board those taxis, and that is a limitation of the numbers in those cabs, as well as the masks, as we say. I've also issued directives based on the advice from the Secretary for Education and the Minister for Education and Higher Education, effectively directing that schools close as of tomorrow, the 29th of July, and this closure will continue to the 12th of August. Both departments, I've been informed, will be releasing separate statements on this. Now, I've sent out these emails these measures via email. I have them on our Facebook pages as well, and on our COVID-19 website. So please get these measures across to your loved ones, to your colleagues, to those of you who we worship together, and educate yourselves and assist others in becoming more aware of the measures that we are taking. again, which will be governing our way of life and the way we live in the city for the next 14 days. To conclude, as I said, our best defense is self-defense. So take care of yourselves. Comply with all the safety messages that we are giving. That is keeping social distancing or safe distancing, cough into your elbow, wash your hands regularly, and please stay home if you have absolutely no reason to go out. There'll be a curfew in place to ensure that we control the spread, and it is basically to, as we've always said, with the curfew, people spread the virus doesn't spread itself, people spread the virus. So in all efforts, I as a controller under Section 9 will do and issue measures as deemed necessary to assist our health workers and those of us in the NCC to defend ourselves, our communities, our country against COVID-19. Thank you and God bless you all.
Last 48 hours, there's been no new confirmed cases.
Okay, so the myth, good question. So we do zero testing, of course, the result will be we have zero positive cases. Yeah? That's why we continue to insist we need to test. Now, do not be lulled into a false sense of comfort or security that what we're experiencing in NCD is confined to NCD. Once we get more testing out in the provinces, once we ramp up the testing, which we hope to do so in this 14-day period in NCD, we can only hope for and pray for the best, but that's, that will be responsible for us on our part.
Are there any measures and protocols put in place for the families of those who have died of COVID-19? Like, are there measures and protocols in place for them on how they can view their body or bury the body?
That's again a good question. Look, whilst we appreciate that there is this customary beliefs and the likes in terms of putting loved ones to rest, that's no exception to those who have also succumbed to COVID-19. Again, based on the best medical advice, we would like to return deceased to their loved ones, but only if it's safe to do so. So whilst it's not a specific measure, but it will probably be necessitated to have one out there in the near future. But at this point in time, maybe if the good doctor can advise us more on this. But the intention is to return recently deceased loved ones back to their families, but it has to be done as safely as we can. Now, again, based on best medical advice, then we endeavour to do so.
Has someone prepared to get some procedures in place in case the families protest over the body?
An issue, a measure, and as we speak, there was something that we commenced drafting, repatriation of those deceased due to COVID-19. But again, until we get some more advice from our medical experts, so it's no use writing a measure up that hasn't had significant thought or research around it, and we need to do that. As I said, we just need to do this as safely as possible. Just before the commencement of this press release, our Prime Minister was in a video conference with Ted Ross, the Director General of WHO, so he was unable to answer some of those questions or provide the answers to those questions at this stage. He most likely has them, but time caught up with us in trying to get this out there and for him to conclude his discussions with Ted Ross. We will make it a point to have those answers for those questions tomorrow.
Could you also clarify on the essential businesses and services?
Okay, so again, a good question. There's been questions about what is an essential service and what is essential business. Again, firstly, let me say let common sense prevail. Essential services, as we know it, are those services that require human existence. Yes. Power, water, access to medical services, access to health services. These are services that we deem as essential services, or which all of us in the NCC fall under the category, and government services. So, essential businesses, whether it be media houses, whether it be post offices, whether it be shops, whether it be banks, those we see as essential businesses. Because as essential businesses, you provide a service that is not necessarily a government service to our people. And in as far as, and again, let me express my gratitude to the media houses for those of you being with us since day one. Without your continuous reporting, without your quite frank and candid questions that you ask us, it allows, one, it keeps us accountable to our people, and secondly, it provides those answers to much unasked or unanswered questions out there. So let me thank you all for that. If there are any confusion as to what is an essential business, our inquiry team is here, our website is there. If you feel that you need further clarification on whether or not your business is classified as essential business, whether it be purposes for operating or purposes for the purpose of traveling around the country to conduct your business, please send your queries through to the NCC, and the team will respond and appropriately. But yeah, so with the measures in place, we're trying not to unnecessarily cause major disruptions. There will be disruptions, granted, there will be disruptions, but there are certain lessons learned from the SOE where we feel that we can do things and approach things differently, and this is how we've done it this time around. Thank you. The second death? Doctor, you want to go through?
But as I said, for the second case, I will give more detail tomorrow. All I can say is that he had a number of comorbidities, meaning he said some other causes that have also added on to his demise. Whereas the first one, we do have the certificate, and we are cleared a 35-year-old, and the cause of his death would mainly be from respiratory failure as a result of the COVID-19 effect. And I've got the medical certificate here, so that's why I'm bringing the point home about what has actually happened. So without that, we can speculate. But the medical certificate here is with me, so that's why we're making that particular point. All right, that's a very good question, and that's something that we will be working on in the next 2 weeks to ensure that we provide those clear sites. Especially in the clinical settings, there's about 32 sites altogether in the National Capital District, and they will be part of that, but there will be others that we will scale up in all the 3 electorates, so that some of it will be closest to the communities, and others will be in settings where there's a lot of people. But as we now go through this particular update, we have our first positive case in Ley on Gene Expert, and is now in isolation. That's as we speak. So more information will follow, but just to know that we have now a first case in Ley. So be clear that the message about being vigilant and being very responsive to all the measures is very, very important for us to all take into account. And just a few days ago, we had a launch in here with UNICEF, who been one of the things that they were doing was supplying PPEs not only to NCD but throughout the country. And so, as far as we know, our PPE supplies are on track, or we have them in stock, and I've given the direction for us to ensure that we get it on track because of the sheds that we are seeing. So the call that's gone out by PMGH is a call that's to all partners and see how they can support and help. But we will continue to provide the whatever is in need, we will get to do that, and we have enough supplies to do that.
Need to remind you all that it is an offense not to comply with directions, whether it be by measures or directions or even anyone acting under the Pandemic Act. It is an offense. Let me remind the city and the country again. For individuals, it is a 50,000 kina fine or 5 years imprisonment or both. That is how serious the Pandemic Act is in terms of wanting to, or basically in the sense that enabling us to do our jobs. For businesses, obviously, it's 500,000 kina and 10 years imprisonment for those responsible in businesses. So, yes, we will be keenly monitoring, the adherence to the measures that we've just put in place as of yesterday, and it is very much our intent to make sure that everyone complies. Again, it is a warning to all of you, those of you out there, that understand the measures. Common sense will prevail, but understand the measures and do your utmost best to comply with them. It is very counterproductive to what we're doing here. It is definitely disheartening for those who wake up every day to ensure that you and I are kept safe. Those who intentionally put themselves at risk in our fight against COVID-19. So that fake news only serves one purpose, and for us to protect our country, that is not what is needed right now. It's totally disrespectful. There are provisions, again, under the Pandemic Act that allow us to deal with this type of behavior, of which the penalties are as I described. And of course, we're working closely with NICTA and through our cybercrime police, Constabulary cybercrime unit, to ensure that we're on top of this, and we continue to monitor to do so. The people are entitled to their views, but they need to express their views, factually and responsibly. That is all we ask. That is all this country needs at this point in time. There's no value in sending out fake news. It is for people's selfish reasons and irresponsible reasons only. So, I can only discourage those who make it their, they make it their business to propagate such fake news around. It'll only be a matter of time. Sorry? Okay, so arresting, obviously subject to the weight of the evidence, and we feel that it satisfies all the elements of the offence. We will, again, the constabulary stands ready to deal with those, go through the investigation process, the arrest process, and of course the administration, the criminal administration and justice system through the courts. As to whether or not we have the holding capacity in our jails, that is an ongoing challenge. Yes, admittedly it is. But that is something that all those in the criminal process are aware of. Thank you. That'll be it. Thank you, and thank you for your time and patience.